Well, the truth is that I always wanted to be a surgeon, but I didn't like general surgery that much. I like thoracic surgery out of all of them, but after rotating with them, I didn't like it that much. So I started doing other rotations. Went to ENT, urology, orthopedics, and fell in love with urology. Like the surgical part of it, doing big surgeries with kidneys and bladders and helping people with tumors. And you can do a lot of reconstruction, putting people back together with problems. And also you have a very good relationship with patients. You can sit down and spend time with them. So it's about the best of both worlds. And that's what, turned me around and ended up being a urologist. We depend a lot on technology. And I finished urology about 15 years ago. And probably about 80% of the things that I do right now, we are doing them in a different way that I was doing them 15 years ago. And many of the things are related to technology. So it's very interesting, the new toys that we have these days. In the same way we can do things for patients with less pain. They can stay out of the hospital not as much as before. We can do things through tiny openings in the skin instead of making those big incisions that I used to make 15 years ago. So work out much better for patient care and comfort. It's one of those fields that you can make a huge difference. Someone with a big problem, big tumor, that you can remove it, and now the patient is going to live, and it should live as long as he's supposed to without any other problems. Of course, it could happen, anything else could happen, but yes, we can make a huge difference in a short period of time. First of all, they're surprised that we treat female patients. Sometimes in my office, more than half of my patients are females, and we treat them for problems with the urinary tract, kidneys, ureters, and bladders. So incontinence, kidney stones, bladder infections, congenital problems. And so I think that's one of the biggest ones, the misconception that we only treat male patients. I tell my patients, that's a question that I answer every day. I tell my patients, it's much better to come and see me, and then I shake your hand and tell you, that's fine. You're okay, everything is fine, than waiting at home and realizing too late that you have a serious problem and now you're in big trouble. So it's much easier to come and give us a call, or stop by and have a quick chat about what's going on, and going home happy that you're fine than waiting, and then it could be too late. I'm involved in a number of things. The number one that I can provide to the community, I do the Shepherd's Hope, which is a clinic for people without insurance. And it could be not only without insurance, poverty level, patients from other countries, so they don't have a place to go. So we treat all of them. I think that we have been blessed with the ability to do what we do. I love what I do, so I enjoy coming to work every single day. After that, then I have a family that they're healthy, and so then you look back at people without the luck that I had, and so we should also, that we are blessed and lucky to give to those that they don't have those things.